So my name is Mark Washko, and when I was about 19 years old, I had an incident that resembled a seizure, and we later found out that I had a condition called dysautonomia or postural orthostatic tachycardia syndrome. And it's failure of the autonomic nervous system. So everything that you don't control, your heart rate, your blood pressure, your temperature regulation, your digestion, basically all that goes haywire in your body. I spent about 2 years unable to get out of bed, went to the Mayo Clinic in Rochester, Minnesota, as well as the Cleveland Clinic. And we later found out that I got this from a tick-borne infection, an infection called babesiosis, or babesia, a blood-brain parasite, essentially. When I came into the Grossgold Clinic, my face was entirely swollen. You could visibly see that I was very ill. It was hard for me to eat. I was vomiting often. I couldn't sleep, and I had really, I wouldn't say I'd given up hope, but I could say that I was at the point where I was frustrated enough that was starting to come into the edge of my reality. Was that I can't do this. What's the point? And I am much healthier and feeling much better today than when I came in here for the first time and met Dr. Grossgold. I think, I don't know, it was somewhere between 9 months and a year ago. So I found out about Dr. Grossgold and actually decided to work with him through his vast knowledge of the human body. Not only human biology and physiology, but taking an accurate approach at not trying to just give somebody a pill to quell symptoms in the time, but find out what's going on internally within the human system. I also work in the field of health, and I see this all the time where someone gets sent to a doctor, they get a pill to mask their pain, and they're doing nothing about what's actually going on with the individual. They're doing nothing to take further steps. And his knowledge of not only medicine, but the human form and beyond is quite impressive. So not only can he give patients what they need who are uneducated in science and medicine, but he's equipped enough to actually have a back and forth with a patient who might be already educated and be looking for a method to further advance their treatment or get themselves out of what caused their issue in the first place. So here at the Grossgold Clinic, we took a step that I think was one of the most paramount steps in bettering my health. I'd gone through so many rounds of antibiotics and they were starting to tear my body up because of my condition. I've tried so many medications, it's almost funny, and most of them didn't work. And a big thing that we did over here that I was actually a huge skeptic of, I was totally skeptical of this, but we did a stem cell transplant across the blood-brain barrier, which is pretty remarkable, and it's only been done a few times across the world in research. If you try to look it up, I came in here skeptical, so there's no way this is going to help, but what do I have to lose? And I had this done only 3 months ago. I definitely saw symptomatic improvement that if anything, I was not ready to accept were going to happen. So it's hard to see a placebo effect when you're mentally against it in the first place, or that it's even going to do anything, and then you start seeing symptom resolution come up out of that. So that was pretty special. I don't think I would have ever done that or been exposed to that as an option had I not met Dr. Grossgold. So what makes Dr. Grossgold's clinic very different is I've been around the world in medicine. I've had what they call the $1 million workup. I've been to what's called the best hospital in the world, the Mayo Clinic. I've been to the Cleveland Clinic. And when you go there, you are literally a number. I mean, they'll call you by number, and you go into a room, you see a doctor for a limited amount of time. The doctor doesn't invest himself in you. And for most patients, this is going to be fine. If you have pneumonia, then you're given a protocol. When you come in with a pretty rare, pretty advanced diagnosis, you need somebody to care about you. And that's what Dr. Grossgold does. I mean, he's obviously my doctor, and we have a doctor-patient relationship, but it's hard not to think about him like a friend, too. You can tell that he cares to the point where it frustrates him and saddens him when he cannot, or if he could not help a patient. And I think that's what brings him to go the extra mile, that he will work and he will dedicate himself to your case until he's got you figured out, and he's not going to stop until he does. So to me, that is what sets him far aside from the majority of doctors that I've met, is that he actually cares. He actually gets involved in your case, and he actually emotionally understands the patient. I think Dr. Grossgold is the perfect match between being incredibly knowledgeable and being very, careful with his patients and making sure that he's doing what's right for the individual. But then I think he also brings in the parts that doctors mostly miss out on, being endearing to the patient, caring for the patient, cheering the patient up, So I think he, honestly, in my opinion, is the perfect mix between by the books, science, medicine, and then let's look into the alternative things that have value and have weight, that you might not be exposed to with other doctors. Nothing hocus pocus, nothing silly, not let's do some crystal healing on you to make you feel better, but let's look into these new methodologies that are being brought out by modern day science and medicine, apply those with what we know works in the past, and look at how we can fix the patient as best as possible.